Hello everyone, my name is Amiiroh Intan from class 1B. I will explain about qualitative and quantitative analysis. The following is general concept of qualitative and quantitative analysis. 1. Quantitative analysis is analysis which is made at the number medical records sits accordingly with the length of treatment includes medical sits completeness. 2. Qualitative analysis is a review of filing in medical records related to consistency and its content is evidence that the medical record is accurate and complete. This is an example of the medical record from IUS. The qualitative analysis component consists of 4 concepts including 1. Patient identification review. Ensure completeness in filling out their identity if all items are filed, the medical record number, patient name, date of birth, and gender. Medical record number 40 51 21. Name Mr. Erson Kai. Date of birth Bandung, January 40, 90 and 94. Gender male. 2. Reporting review. Ensure completeness at the annual assessment, general consent, medical resume, informed consent, anesthesia report, operation report, medical resume, problem or diagnosis entry, unspecified appendicitis, final diagnosis, acute appendicitis, order and unspecified. Main, acute appendicitis, order and unspecified. Operation report. 1. Laparoscopic appendectomy. 2. Injection of anesthetic substance. And 3. Ultrasonography of the abdomen. 3. Authentication review. Ensuring the completeness of the validity of the recording authentication if applicable, doctor name or stamp, doctor signature, nurse name, signature nurse, professional title, doctor name, Dr. Zainal Musakir, doctor signature. This is doctor signature. 4. Review documentation. Ensure correct documentation if clear and legible recording. Use of abbreviation, correction of writing error, if there are lines that are blank is marked. Qualitative analysis. 1. Review the completeness and consistency of the diagnosis. Review the completeness and consistency of the diagnosis. This review will examine the consistency of the diagnosis in between 1. Diagnosis at admission or reason for admission being strict, unspecified appendicitis. 2. Final diagnosis, acute appendicitis order and unspecified. 3. Main diagnosis, acute appendicitis order and unspecified. 2. Review the consistency and completeness of the diagnosis record. Consistency and completeness is an adjustment or compatibility between one part and another and with all parts. 1. Exit style. Appendix problem resolved and patient Quantitavie normal. 2. Doctor instruction. Patients are expected to be controlled after 1 week after surgery. 3. Review record during treatment and medication. Explain the patient condition while being treated and must keep all the results of the physical examination and supporting examination and record the action that have been performed on the patient. When supporting investigation laboratory, complete blood count. 2. Radiology, abdominal ultrasound. 4. Review for informed consent. Analyze the approval letter from the patient whether it is filed correctly and compatibility according to the procedure and rules made in a manner consistent. Disadvantages of the medical record form. 1. There is no result of the anatomical pathology examination. In the patient medical record, the results of the anatomical pathology examination are required to determine the patient condition from head to toe and for other further examination. 2. Incomplete resume. If the resume is incomplete, the identity, illness, and examination are not maximal and health workers have difficulty recognizing the patient medical history and claims the insurance company. 3. Informed consent has not been signed by the patient. Informed consent itself is a form of communication between patient and doctor, with the aim of providing information about planning procedure and or treatment, risks of action, benefit of action, prognosis of disease, and other alternative therapies. Conclusion. Quantitative analysis component. A. Identification review. B. Listing review. C. Reporting review. D. Authentication review. And qualitative analysis components. A. Completeness and review consistency of diagnosis. B. Review consistency and completeness of recording diagnosis. C. Current record review care and treatment. D. Review is informed consent. And this is my video. I hope it can be useful. Thank you.